Hello and welcome to HealthETalks, the podcast where all voices from across the healthcare spectrum come together. We're thrilled to bring you insights, stories, and discussions from a diverse array of healthcare professionals. Whether you're a nurse, a doctor, a therapist, or anyone passionate about health and wellness, this is your platform. So let's dive into today's topic and explore the world of healthcare like never before. Join us as we embark on this journey of knowledge, empathy, and innovation together. And welcome to HealthETalks.
Hello and welcome to our first episode of HealthETalks for the new year. We are today with Jerid, who started off as an occupational therapist, but who's also now leading the future in healthcare. How are you doing today?
I'm doing well, thank you.
Thank you so much for coming onto this podcast. I'm very, very excited for everyone to hear your amazing background experience and how you are actually shaping the future of healthcare. But first off, tell me, we discussed about your aptitude test in high school. How did that test and your early experiences, like receiving occupational therapy as a baby yourself, shape your decision to pursue a career in healthcare?
Kind of what I explained before. It kind of came up a lot in the aptitude test, those sort of quizzes you take in high school, kind of guiding you. And I didn't know what it was. And occupational therapy kind of came up a lot. And I went to my mom and she said, well, you had to see one as a baby. And I was kind of confused by that. I was like, what? And she's like, yeah, you had underdeveloped stomach muscles. And so I had a twin brother, and she noticed that I was not hitting my growth milestones that you're supposed to hit as a baby. And she kind of, just knowing the help that I got from an occupational therapist, it kind of was like, oh, that's kind of great. And like, I like working with kids. And so I was thinking that's a pretty great profession. So let's look into it a little bit further.
Amazing. And you mentioned our previous discussion that you had a cousin who was on the autism spectrum, and that had a profound impact on you. How did those experiences influence your approach to patient care and occupational therapy?
Yeah, so in addition to like me needing to see an occupational therapist, my mom explained that my cousin also had to have an occupational therapist to help him sort of learn different things that he needed to do in this day, from like going to the bathroom, helping out at home, things like that. He was also nonverbal, and I love my cousin. I'd always interact with him a lot, and so it was interesting to know that it was another professional he was working with, and I was always interacting with him. We had our own, like, since he was nonverbal, he was very tactile based. And so it was, whenever I would hang out with him, it'd be like very tactically based.
Yeah.
Like his hands very sensitive. So just developing that relationship and having that reference of another person in my family that had a disability, nonverbal, but still being able to communicate, kind of assisted me in kind of understanding that world a little bit more. And I guess getting to know someone without having to use that inherent, or what we think is that first ability of language, was kind of informative.
And having worked in diverse healthcare systems across South Africa, Canada, India, and the US and Canada, what key lessons have you learned that continue to shape your perspective on global healthcare?
That one, the diversity. There's different diversity of thought and just the diversity of people. I'll go with the diversity of people first. I was so lucky to have those opportunities to meet so many people. It was phenomenal, and how they interact with each other. It really helped me develop my cultural reflexivity. So definitely treating people almost like every conversation and looking at their identities more than just like one or two, like you're this and that. And it's like, oh no, you're more than that. You're much more textured of a human being. And so you're not just my patient. You're a patient that comes from this area, who speaks this language, who has this history, but also this ambition. And so, and then being aware of myself as well, and where I'm in that presence and that power that I hold and what power I don't hold. So that diversity when communicating with others, but then also the diversity in perspective when it comes with healthcare, where working in India, South Africa, and areas of Canada, and the United States, where you're under-resourced or over-resourced. And for some reason, when we're in the under-resourced locations, why are we performing more? Or like, why are we performing better? Why do we have better team dynamics? Or why are we more innovative? Even though
Yes.
when the places where I've worked with more money, yes, we have big, innovative, great machines, but sometimes we have more dysfunction. And just kind
Mm.
of, I love that diversity and experiences and kind of bringing them all together and then seeing problems as puzzle pieces, bringing, when I see a new problem, bringing all those experiences together and be like, oh, I got this from here, I got this from here, and this from here. Let's sort of figure it out together. That's what I really loved from the diversity of perspective from the people, and then helping with my problem solving when it comes from under resource, over resource, and then also from a group dynamic perspective from diversity.
Yes, that's right. Because you can take lessons from this place and then try and integrate it into a different place. And I think that's why I have so much respect for you. Like having to be in all those different settings, and then you just come up with problem solving skills that most of us probably did not even know about from the start.
Exactly. And then it's also an education piece where working in rural India, we had rehab aides that would go into the community that had iPads that were tracking progress and on a specialized app for this rural rehabilitation center. Where I remember back in the day, I was like, we didn't have that in Canada. And I was thinking, like, and the preconceived notion. So it's like you're checking yourself, and I can bring that back to say this innovation was taking place here.
Mhm.
Why can't we bring this innovation here? Like, and just kind of bring that again, that problem solving aspect. And then similarly, like pieces from Canada, where I'm in the United States, and from South Africa with like different techniques of therapy. I have actually used back home and in Canada, United
Mm.
States, where it's like, oh, like I remember this physical therapist doing this technique to activate a muscle from back in 2010, and as and it still works, and I learned
Mm.
it here. And so just that knowledge sharing from all those different exposures has been phenomenal, and just giving reference and kind of giving respect to where it came from and sharing that with people to know that history
Yes.
kind of gives the places more, I don't know, more light and the honor it respects. Like that came from South Africa, that came from India. Like think of those places where you do
Mm.
that technique. Yeah.
No, that's right. And
Mhm.
what motivated you for your transition from occupational therapy to healthcare administration and consulting? And how has this career evolution enriched your ability to drive meaningful change?
Um, so that's a couple things. The first big one was um, myself and a lot of people that I love were kind of being failed by um, healthcare and a lot of my clients. And I kind of wanted a bigger influence. So I was trying to do that on my own. And so kind of started my own company, but knowing that I needed something else, I needed an understanding of the system. So that's why I'm sort of transitioning into that healthcare executive, healthcare
Mm.
administration. So I have that one, that understanding, but also that influence to get that best practice out there, to influence policy, to influence more on a system-based thing, but also lead to educate further, to not only from clinician to clinician and clinician to parent or clinician to client. It's going to be clinician to department. It's going to be leader, individual to a system. And that's the goal I kind of want to have. So that's the first part is kind of in respect to the people that I know and love. And I
Mm.
want to make sure that the care is kind of back in healthcare, kind of what we talked about before as well. And just thinking about them. And another one is just kind of how I think as an occupational therapist and kind of looking at occupational science. Like we look at the person in the middle, and then we look at the different aspects of the person. So we look at the physical, we look at the cognitive, we look at the emotional, but also we look at the spiritual. And then looking at the things that they want to do. So their occupations, but also then we look at the environment that they have to do it in. So then we look at the physical environment, the governmental environment, the cultural environment, the social environment, and then also their ambitions, and then where they come from and what's influencing them. And that can be applied to an agency, a government, organization. So not only do I have the drive, I've proven myself to have that skill set from that occupational therapy lens to say this can be applied to an organization. And I have to say, okay, these are your barriers, these are your goals, these are your influences around you, and these are your components. And I've already been doing that for over 12 years for clients and small groups. So being able to scale it up only made sense.
No, definitely. And we've spoken about you being involved in patients and empowering them, and you've emphasized that involving them in their care decisions. How has this philosophy influenced both your clinical practice and your approach to organizational transformation?
So with that one, it's proven time and time again. There's so much research around it. I've seen, can I bring it back a little bit? A lot of the people you've talked to on your podcast and a lot of healthcare workers, we've seen people at their lowest. As an occupational therapist, I have the privilege to look at someone and say, what do you want to do? What makes you happy? And what gets you out of bed? Even though they may not have been able to get out of bed for the last 3 days. And to see that light come up and what gets you out of bed, getting asked that question, what you want to do, activates a person. It gets them to take ownership of their care and gets them to participate. And there's so much science behind that to get them to be involved with their care planning. There's autonomy in that. They have responsibility. There's accountability with that. There's a lot more steps before it, but there's the same idea when it comes to organizational behavior. When you have a staff member or a group that has clear communication on a goal, a clear idea of what their path is within an organization, has autonomy over the direction of their tasks or their career path, they have more enjoyment, they get more out of it. So it only, like, those two almost parallel each other. And so that's kind of how it influences each other. That's how I see them together, because again, the science supports it. It only makes sense. And I've seen nothing but positive benefit from it with my clinical work, and then also with my work from an organizational standpoint.
No, definitely. And you also mentioned like advocating for social justice and community empowerment in healthcare is essential to your work. How do you integrate these principles into both individual patient care and the broader systematic change?
So it was a couple of years ago. I read this design book, and it talked about designing for the most accessible place, making it accessible for everyone, and that make it most accessible for the person that it's least accessible for. That means everyone can access it. And so just from that perspective, and also as an occupational therapist, it just kind of inherently, if I think about social change and I want to make things accessible and design a service or design a piece of equipment, if I'm designing it for the person that cannot access something, the least accessible, that means after I build that, everyone can access it. And I just think that's beautiful. And I think that's what we should all be striving for. And so I'm kind of forgetting parts of your question, but that's again what I'm striving for. And that social justice aspect, it helps me, especially when communicating with other people. It helps me with my communication, with my trauma-informed care, my trauma-based care. And then also that sort of reflexivity of having a communication with someone and seeing where they're at and knowing where I'm at with my communication with them and with where I'm at with my therapeutic sort of process with them, or my therapeutic arc with them. Yeah, so let me know if I'm getting off tangent from the question a little bit. But and also it's there because me as a healthcare worker, I'm very aware of the power that we hold. And a lot of people come to us that don't hold that power. And when they come to us very weak, very sad, in these states of trauma, and then coming into healthcare, and if you go into an ICU unit or a hospital, that's a very traumatic thing.
Yes.
And then to be treated poorly when you're from a community that's already been treated poorly by the healthcare community, how devastating. That's devastating.
It is.
So to have that hat and an extra bit of empathy, or that extra tool in my toolbox to be able to communicate or humble myself, or to artfully communicate to someone that may not have experience like me, why not? So then they can leave and access the world a little bit better, and then they have better health outcomes, and then they're not using the services anymore, and that means they're not they're not using the public funds. They're independent. They're being productive, if you want to go that sort of route, but they're meaningfully moving through life because they're no longer traumatized from the system that put them there in the first place. They came to a place for, again, health and care, and they were treated with it.
Yes,
and
that's
so
great.
So that's kind of where that social justice part comes from.
Just giving them that positive experience so they keep going back and seeking healthcare, not having that, oh no, this happened to me, I won't go back again.
Exactly. And I have many friends who, they fear it. And at times I do too. I don't want to go back to that same clinician, even though they're my doctor or therapist. And then the burden on you to find a new one. And then to find a new one is very scarce, that's another barrier to care, which I want to try to avoid as much as possible.
Definitely. And the project that you've been working on that we spoke about is fascinating, and it ranges from you mentoring students in wearable technology for neurodivergent individuals to engineering adaptive equipment for people with disabilities. Can you talk a bit more about those projects for us?
For sure. So there's kind of three main projects I'm a part of. One, research study, but we've kind of talked about it a little bit before, was around chronic pain in the two-spirit LGBT community. But the two that you mentioned is more around engineering and design as well. The adaptive equipment is, I'm a part of I'm mentoring a student group at the University of Washington. And what we do is we get community members where they're, say, I have a child with cerebral palsy and I want to be able to go into the garden with them and so they can play with their sister, but they have poor core stability and I want to be able to feed them. And it has to be lightweight because my wife isn't very strong. And so I come in as the clinician that has an experience of possibly making a system like that. And then I have engineering students that are working on it. And then they get to practice interviewing, so they get to practice empathizing, they get to practice being in the position of that father.
That's
caring
right.
in their role as a father and the occupations as the father. So their occupation is feeding, their occupation is a caregiver, their occupation and love for their child. And then they have to empathize and then build a piece of equipment with looking at ergonomics, looking at what materials will be durable. So I'm coaching them from the empathizer standpoint, from the communication perspective, and also from the design perspective and materials perspective. And so that's super fun. And then also we're building right now a specialized backpack for someone who is low vision and blind, and this person is like, hey, I'm really adventurous. I like rock climbing. I want to go to my job, then volunteer, and did it all in one day. And it needs to be for me and my dog. And so we're designing a customized backpack. So it's not rubbing, it's ergonomically safe for them. And it has all the kibble for the dog, and it has for her white stick and all these other things. And I love those problem solving ideas.
Yes.
And so that's really phenomenal. So that's one of the things I'm doing right now. And then another one is, which just got started off the ground, was mentoring this capstone project, where it's doing a proof of concept for a wearable device matched up with an app that will look at physiological markers, so possibly heart rate, cortisol levels, blood pressure, possibly blood glucose, depending on what the wearable will be taking that
Yes.
on, if it's subcutaneous or cutaneous, but also environmental information. So it's like the interaction you had with somebody, how loud is it, also your sleep cycle, and then it's looking at people who are neurodivergent or with mental illness and preparing them for the day, preparing them to be able to participate in activities like work, school, their relationships. So an example would be they're going into actually coming back to this a little bit is it would be like a log. It's like, hey, earlier today, your heart rate went up. It was at this time. It was in the office. Well, this person was talking to you. How were you? So it kind of would prompt them to retrospectively think, log, and also give you live feedback on how to sort of control, like, hey, you're kind of anxious right now. Are you okay? And so those are kind of aspects to it. It's a little bit broader than that. It's kind of bringing in those physiological aspects, the environmental aspects, even noticing how your speech, you're speaking pretty loudly right now, or your speech is a little pressured. So it's just, hey, how's her? And so it's like that may be signs of anxiety, or if that's a symptom of, say, your ADHD or your autism, but you still want to manage that, if that's your choice, if you want to manage that,
Yes.
that might be something that you want to be looking at is, oh, you might have been triggered, and maybe this is a strategy that you really love using right now. This is what you can do. And so that's one of the projects that I'm working on right now with a couple master's students at the university as well.
That's amazing. Like just the way you think about it, like the device in the backpack and all of that. It's things that should have been out there a while ago. It's just no one actually like.
Enjoying this episode? Ever thought of starting your own podcast? Podup.com is your go-to. They've got everything you need to run a pro show, including 35 or more AI-powered tools for success. Sign up today for a free starter account and get 15% off with the code HealthETalks15. The code is HealthETalks15. Plus, check out podallies.com for a done-for-you podcasting experience, complete with website, social media, and editing. Start now and let's launch your podcast together.
Went into it and started it. I'm so glad like someone like you have gone into it now and shaping the future of healthcare.
I like it because it's like it's still kind of paying homage to like the occupational therapist, but also the interest in technology and the data, and like even the computer science one, the sort of aid, like the co-regulation device. I'm touching here like it's like a watch, but it's like we're asking people, what do you want to wear? So is it going to
Yes.
be an earring? Is it going to be a necklace? Is it going to be like almost like a fake tattoo? We don't know what it's going to be yet. But there's lots of things to work through. Like, what does data sovereignty mean? Like, who owns that data? And for me, it's you own that data. Because when we're talking about the bigger world about artificial intelligence and data management and data security, a big thing for me, especially when you're going back to that sort of social justice aspect, is like, who owns that data? Because that
Yes.
data is powerful. And so it's you own that data. And it's like you can share it if you'd like, but if that is your healthcare data and that's the data you want to share, that is up to you.
Yes.
And so that's something that we also talk about in the class, especially around ethics and around intersectionality. And if you're from an intersectional perspective, that is so important when you have ownership not only of your body, but of your information.
That's right. That's right.
Yeah.
And you mentioned before your research focuses on access to care and the chronic pain for underserved communities, including the LGBTQ plus community and two-spirit populations. How does your background in occupational therapy inform with this work?
So that started when I worked at the Seattle Children's Hospital as the lead occupational therapist on their pediatric pain team. I got a job at Seattle Children's Hospital, and this was a dream, like the dream. And this position. I was like, oh, this is kind of interesting. But it was probably one of the best jobs I ever had. Interdisciplinary team, psychologist, nurse, social worker, physical therapist, anesthesiologist. But it was occupational therapy and physical therapy that were at the front of the team. We were with them the most. We were practicing cognitive behavioral therapy. We were doing fun activities with them. We got to ask, like, well, what do you want to do? We were talking about education, what it would look like. What does your day look like in the classroom? Um, uh, it was, yeah, it was really intimately getting to know people and seeing them from like really the biopsychosocial model. Like biologically, yes, this is happening to your body. Physiologically, we see your skin very red, very puffy, but psychologically and socially, what's going on? And knowing how
Mm.
it's so connected to pain and a flare up of a pain episode, because you're anxious about something, you are triggered about something. So let's talk
Yes.
about that while working on distraction techniques, while we're working on desensitization, while making you feel safe here. And so, and it was also about re-engaging into occupations. And so a lot of these kids had to relearn how to be a kid again. And so it was up to me as an OT to be like, hey, let's go play. Let's go do some dishes. Let's learn how to be a
Mm.
son. Let's go learn how to be a daughter. Let's go learn how to be a student. Like we had to sit in a desk for a while or advocate to a teacher, hey, can I switch positions because I'm uncomfortable after an hour? And so those are things I would work with them on top of things like making friendship bracelets, or I
Yes.
remember wearing a hoop skirt and that was practicing our gait movement. But also this one client loved making hoop skirts. And so I remember walking down a hallway in a hoop skirt because this is what they love to do. And I had to bring that into session because I found out this is your strength. This is what you want to do. And yeah, and changing words of like instead of screaming, we're talking about okay, we have to change that. Instead of screaming and saying ouch, we're gonna say booyah. So because because it sounds funny. So we're gonna
Yes.
reframe these things that are usually around pain and that sort of intersectionality part around the multicultural perspective, especially that 2S, like that two spirit perspective, is the study that we're doing is really trying to push the fact that a lot of people don't experience pain the same, especially around minority stressors.
Mm.
Women, Indigenous people, especially in Canada, because that research is based in Canada. So it's like two spirit that's really towards our Indigenous population and people who identify as two spirit, um, especially within the queer community. That's a group of people that has a level of pain that a lot of people don't know about. And if you don't know about it, and they can't speak about it, how are we supposed to help them?
Yes, definitely.
And so that's kind of the background of that. And that's the work that we're doing there. And that's how I got into sort of pain research as an occupational therapist. And yeah, and I love this story. Can I share a story about sort
Yes,
of
of course.
okay. Um, a perfect example. I wish I had the video with me because it's a beautiful video. I was working with this client in Vancouver, British Columbia, this older lady. She was, I was her case manager. This is when I was doing my contract work.
Mm.
She was on a bus and the bus got in an accident and she fell. And when she fell, she broke her hip. This is before the pandemic. And after she broke her hip, she had a surgery. Surgery, fine. So physiologically, everything's okay, but excruciating pain, excruciating pain. And, but for 2 years, almost sedentary. She's been working for a
Wow.
with a physical therapist 2 times a week, um, an aide occasionally, an occupational therapist, going to doctor's appointments almost every month, but making no progress, no progress. And then I get put on the case. She gets transferred to me. And I was like, oh, wow, this seems kind of tough, intense. And then I go to her house. She's sleeping on a couch. This elderly lady sleeping on a couch. Her daughter has to work 2 jobs. She has the bedroom, her
Yes.
own garden suite, so a basement suite. Um, they're originally from the Philippines, so they're new Canadians. And I got to talking to her, and she's an older lady. She was scared. Her first language wasn't English. And the more I started talking to her, she talked about her kids that were in different countries. So she's talking about missing people. She's talking about fear of falling. She was talking about how she misses her daughter when she has long hours at work. Even though she has an aide, like her aide is, even though she speaks the same language as her aide is not her family.
Mm.
And again, I asked her, like, well, what do you want to do? Well, I want to go to the bathroom by myself. I want to do this. What do you like to do? I like to dance. I was like, well, we're going to make goals around that. This person who, for almost 2 years, excruciating pain, couldn't do much, could hardly go to the bathroom by herself, got in 2 weeks, I got her dancing with me to the song Cheek to Cheek. She
Ah,
loved Frank Sinatra. She loved the Gaelic music. I was playing it with her. It was summertime. We would bring the table outside. I got her up and down 12 steps independently in 4 weeks, something that a physical therapist can, because I met her where she was at, because I
that's
got to
right.
know all those factors, where she came from and what her goals going forward were. And I asked her what she wanted to do. And all that work, literally 2 years seeing an, a physical therapist, been through multiple occupational therapists and aides and a doctor, and then the insurance company telling me, oh, we might have to put her in a home because the assistance we're giving her is too expensive at home. And I'm like, but no one's done the right work.
Yes,
And then in 3 weeks, I get her dancing pain-free.
that's amazing. That's such an amazing story.
But because I asked her what she wanted to do, and
Exactly.
in less time, I got her doing what I wanted to do in less time than what people have been trying to do for 2 years.
Uh,
Yeah, so that's just an example around that pain aspect and trying
Yes.
to be the cultural aspect, the trauma aspect, which is huge. And also just I know I'm aware of what I look like. I'm a very large, I'm 6 feet tall, I'm 200, next to 250 pounds, masculine presenting. So when I meet people, I know to bring myself down, I soften my tone. If I meet other people, I know how to really scruff it up. Um, I come from a very country background, so if I see a pair of the cowboy boots, I'm like, I know how to, oh, how them shit kickers. Like you have to bring that in the room, like because it makes people feel safe. It makes
Yes.
people feel safe. You have to ask the questions. Oh, hey, where are you from? How you doing?
Mm,
What do you want to do? And you actually get better outcomes and a lot quicker. Yeah.
definitely. No, that's amazing. It truly is amazing to see someone like you, like you said, in that short amount of time you got her to dance pain-free because you met her at where she was at and did what she wanted to do, and not someone just telling her do this and not being
Mhm.
motivated at all.
Yeah. And then with that, I was able to use that as an example of, okay, now we're going to make a sandwich together. And she was like,
Mm,
oh. I was like, but remember when we were dancing? We were standing. So what we're going to do is we're going to play music and we're going to sway as we make that sandwich.
amazing.
Like,
And it works.
like, and pain free while making a sandwich. She was going to the bathroom, like all those things I brought in, and then I was able to take her off my caseload.
That's amazing. That truly is inspiring as well. It's doing inspirational work, I must
Yeah,
say.
I was like, you fired me. Like, that's what I want. I want you to fire me. I want you to fire me. I want you to use these little tidbits that I'm giving you in every single place because now these are your strategies. These are what works for
Mm,
you. Yeah.
that's amazing. And for my last question for you today, you've spoken to me before about putting the health and care back into healthcare. What specific changes do you envision to create a more human-centered and compassionate system? And where do you see your career heading in the next 5 to 10 years?
Um, so the first part, putting the health and care back in healthcare. I think I gave little samples
Mm.
of it on how to do it,
Yes.
and what my mission is. Um, and I want to keep on doing that, giving more examples of it. Just because there's a lot of people suffering right now, and a lot of people in my life have suffered at the hands of healthcare, which is very perplexing. Health and care, like
Mm.
it's just like it's in the name. There should be health and care in it, but it's 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 not that. And so my mission is to bring it back into it, and which is another reason why I'm going to this administrative route. Um, and I almost forgot the question now. Sorry, can I get you to repeat it?
No problem. It's just how do you
Yeah,
envision
yeah.
the to create a more human sense and compassionate system, and then where do you see your career heading in the next 5 to 10 years?
How? Okay. Yeah, so bringing those pieces in, all those things that I mentioned before, bringing those skills, bringing my frame of reference and teaching people, hey, this is how you can look at this problem. Um, oh, this is looking in the problem and like looking at the problems differently. Like I said, I have this beautiful lens that I'm like, I feel like part of it's a gift where I'm just like, I don't know where it came from. Thank you, whatever implanted in this in me, and thank you for my experiences, even though some of them have not been great, but they taught me to have this sort of core of empathy and understand when I don't need to be in the room, like someone else may be better. Like someone
Yes.
else could be better. Like I know someone else could be better. Um, and so that's also an example, like humble myself, like I don't need to be there. And yeah, I want to bring that perspective of like we could do better, people. We can be
Mm.
kinder. Like we can look at things differently. Like we mentioned before too in our past conversation was like I listened to your podcast and a lot of people like we need money, and that's real. But also we need to look at the problems differently. We can't keep on hitting like the screw with a hammer. Like we need to look at the problem differently. We need like, and that's what I love about the vision and how I look at things. I can look at all these variables. I'm like, oh, okay, great. And what I said before about getting all these experiences from all these different countries and all these different people and all these different areas, even within Canada and the United States, is just like I can look at the puzzle differently. And so
Yes.
that's really the how. That's how I really want to change healthcare is I have this beautiful way of problem solving and looking at things because of the academic perspective and my experiences, um, and the models I come from. And I can sort of flip the puzzle on the side and be like,
Yes.
oh no, 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 that fits here. Um, and then the next part, where do I see myself in 5 years? Ooh, that's a hard one.
Yes. I can
That's a
imagine.
hard one because it's I'm so diverse. It's so my interests are so diverse. I would love to be in a position where I'm doing more stuff like this. I'm talking more. I'm talking about data sovereignty. I'm doing design work. I'm doing policy, influencing policy, making sure that the health is in care, but I'm also then going to hospitals, I'm going to communities and making sure that they have the autonomy. They have their voices are being heard and so that their care is being met. So I'm kind of manifesting, not maybe saying the position I want, but saying that this should be in the job description.
Yes.
And so, yeah, even as an occupational therapist, I always said I want to be a practicing researcher. And so I want to be able to be in the clinic, helping people, doing my group work, going to the community, but also always contributing to advancing research.
Mm.
As a in healthcare administration and kind of what I'm doing right now, I'm doing that very same thing. So I want to be continuing to do that, but with a nice shiny title.
Yes, definitely.
Because I think there's lots of value because it keeps me humble, it keeps me connected, and I think every good leader should be continuing to do that because I think even as clinicians, we get disconnected. And as leaders, and I think a lot of leaders right now, even in healthcare, we think we're doing noble work by leading in healthcare, but there's a lot of disconnect that's happening.
Mm.
And I think with that idea and the model that I have in my mind, of what kind of job I want with the way things are going, or like in the future, like the data, the AI, thinking about antimicrobial issues around mergers and acquisitions, about the business, about public health. You need to think about that. You need to think about the past, and you also need to have your humbleness and what are the students doing? Where is the community at? So I would love a position that does all those things.
I'm sure you definitely will get a position like that, saying like manifesting all those amazing things you're doing. Like I mentioned before, would love to speak to you within a month again, because I know for a fact that there's going to just be something more and more that you're doing.
Right, yeah. Well, yeah. Even a conversation last night
Manifest.
with yeah. I have a couple of things that are on the to-do list, even for myself. Like a personal strategy for myself is I keep like a project management board. And that's for my like my own brain, but also as like a way of manifesting my ideas as well, my dreams. So
I'm sure you will definitely achieve them.
yeah, yeah. Thank you.
But Jared, thank you very, very much for your time today. This was so insightful and exciting at the same time, and I know our listeners will feel the exact same way. And like I said, I can't wait to chat up with you again in a few months or so and see where all your projects and where you're at.
Thank you so much, Julie.
And to all the listeners out there, remember to like and subscribe, and we will see you on the next episode of Healthy Talks.
That's all for today's episode of Healthy Talks. Thank you for joining us and being a part of this diverse and insightful journey through the world of healthcare. Your engagement and passion fuel our discussions and inspire every episode. Don't forget to subscribe for more engaging content and share your thoughts with us on our social media platforms and YouTube channel. Until next time, stay curious, stay informed, and keep making a difference in the healthcare community.